So before I met Jessica, I was experiencing chronic pain in my hip and surrounding muscles for approximately 3 years. I had been training for a marathon at the time, and initially I thought it was actually my groin and didn't realize till I went to see my PT eventually that it was actually my hip. And at that point, I was convinced that all of the issues I was having was related to the labral tear. And because nothing else had worked up to that point, I had opted to have surgery to repair my labrum. And I started to think that I may never really be able or shouldn't be able to run again. The orthopedic doctor had told me that as well. Spent 6 months in PT following the surgery. Started to run again gradually, and then about 2 months into running, I came back from a run and noticed my pain was very similar to what I had had prior to the surgery. The pain was an everyday thing. I was hesitant to do anything at all active with my family because I knew even just the smallest bit of exercise, I was paying for it the next day, an extra sore on the left hip. So I made the decision to have a second surgery. They started me in PT the day after surgery. I started to feel like my hip was actually more stable and strong. Once I got the clearance to start running again, it's my true passion. I decided I wanted to train for a half marathon. I hadn't been able to run one in like 3.5 years since all of this started. And then once I started training for this half marathon, a couple months into it, I started having like a nonstop just wave of tingling on the left side of my back. And then it eventually kind of started in my left foot as well, where it was just like a constant thing. So at that point in my training, I was really discouraged and kind of scared because I was thinking that there's something else going on. And I was scrolling through Instagram one evening and I came across ad for or Jessica's page came up, and the words flashed across my screen: "Are you a woman with chronic hip pain? Then this program may be for you." And so I decided to fill out the contact form and schedule a meeting with Jess. And we met a couple of days later, and that's kind of where it all began with Jessica. I joined the chronic hip pain program because at the point when I was talking to Jessica, I felt that I had exhausted every other option and avenue. Surgery, in my opinion, was the most extreme option for treatment, and I'd already done 2 of them and still was not feeling like it had been effective. The pain I was having, it was still there. And when I talked to Jessica and came across her page, she kind of confirmed that there is a lot that we can dive into. And the fact that it probably didn't even have to do with just the hip itself really kind of spoke to me, because I, again, thought that there had to have been something else that was going on. I was willing to take the leap of faith and do what I thought I needed to do if it meant that my quality of life would be improved, and that, at some point I can like go on a hike with my children or go out and run around in the yard again. It was a risk I was willing to take. So as far as the results that I have seen, from the beginning of the program, I was in the middle of a half marathon training plan when I started the program with Jessica, and she was totally on board and supportive with helping me kind of just make it to that starting line and get through the race, but kind of letting me know that it may not be, I might not be where I wanted to be by the end of it, and we'd probably have to take like a step back and really just set some focus on the issue. Just week 1 was just some mobility exercises that were introduced into the program. I started doing those every day, and just with those mobility exercises alone, I was able to get through all of my training runs after that point. I had been at a point where I just thought that my hips were kind of defective and would never be able to sit like crisscross applesauce. I had very limited range of motion. And when I started the exercises, it kind of blew me away as to how quickly my mobility did improve. And I was kind of wondering why I was never doing these exercises before. I was able to successfully get to and through my half marathon, even with a couple of speed work sessions in there. But after the half marathon, I did know that there was still some work to do. So Jess and I kind of had me take a step back from any kind of running and training. A huge component of the program for me also was the pelvic floor part of it. As a mom of two, I had never been told or realized that pelvic floor dysfunction is something that I might have to look for, as it's pretty common, I think, in most women who give birth. So the pelvic floor, when Jess started talking about that, was not something foreign to me. I knew I had had issues before, but the way that she presented it was kind of totally different and made me think about it in a different way. Once we started to address that, and I could feel the difference with the muscles in there, and then kind of see that start to line up with the pain starting to dissipate, that was pretty cool. As far as my life being different, just like on a daily basis, I have done things like with my kids and family that I haven't done in years because, again, I was hesitant and afraid of the aftermath of the soreness that I was going to have. For instance, I went to a trampoline park for my daughter on her 9th birthday this year, and I jumped and I didn't even pee myself. And just a couple days ago, we were with friends and we were playing capture the flag at night, and I was running around. And yeah, so just the fact that I don't have to second guess or think twice about being able just to do stuff with my family has been awesome. The way Jess kind of walks through each individual result and kind of helps you tailor your program on your like individual results was really nice and helpful. Even aside from just the exercises, which were all great, there was a section with breath work. Jess was pretty certain that I had some underlying like central nervous system issues going on. So basically, I had just had a lot of stress that had piled up over the years that kind of hadn't been dealt with. So we had to kind of step away from the physical aspect of it. And I really dove into some breath work and journaling. And I was quite honestly amazed. I was on vacation with my family, and I told Jess when I had come back that I had realized that week that the tingling in my back, because I had still had it up until that point, that it had gone away. And we kind of knew we were kind of hitting the nail on the head with the central nervous system stuff, just because just taking myself out of my normal kind of stressful environment and just being away for a week with no distractions or responsibilities, I was so much more at ease. And that is not something that I would have ever come to figure out or think of on my own if I hadn't joined this program. I would tell other women who are looking to achieve freedom from chronic hip pain, just don't give up. I was definitely at some low points mentally before I started this journey. And even, still there's some days that are a struggle, but I've learned to kind of retrain my mind that like I have had strings of weeks here where I haven't had any pain and no issues. I've been able to run pain-free and do things pain-free. And I now know that I am not, I don't have a defective hip, and it's not going to keep me from doing the things I love. It's going to make the rest of your quality of life so much better. Jess knows what she's doing. I've heard the success stories of other women. There's the support of other women weekly. There's a weekly call where you get to hear other women talk about. So there's a lot of us in this boat, and Jess is a good captain to be on a boat with. With the virtual, it was really nice because I could kind of do it when I had time, and I didn't feel necessarily pressured to have it done at a certain time. And even though it was virtual, the communication was great. Jess was always kind of right there. If I sent her a question, she's very, very responsive, and she prefers the communication throughout the program. Because the more the better, then she can kind of figure out exactly what's going on. And if I had any questions or issues, I could take pictures or videos and kind of send them over her way. It was just a set of expertise, that I had never been offered before. Even when I kind of let my PT here at home know what was going on, even though his specialty is not pelvic floor, or specifically like the issues that Jess has been trained over the years to treat. But he was like, oh, well, yeah, there is a big connection between the pelvic floor and the hip. So I kind of knew I was in the right place and had to follow through with this program.